name is Jodi Wilson. I work for the Mental Health Association, advocating for children and families, for children who are in need of services in any child serving system. I work 30 hours a week. I should say I get paid for 30 hours a week. I work much more than that by choice. I used to be one of those parents. I have a almost 21-year-old son who is severely disabled. I have a 15-year-old daughter who was eligible for access only because she was in need of mental health services, and that loopholed her through. I made too much money for her to be insured through that otherwise. I quit my job in 1996 after working 6 years at Warren State Hospital as a psychiatric aide to care for my severely disabled son who had a lot of neurological problems. He's physically disabled, mentally retarded, behavior issues and whatnot. I did work evenings, I worked days, I worked nights to try to accommodate his needs. Nothing seemed to accommodate. I asked my employer even for an alternate schedule to maybe come in a little later, work a little later. They weren't real happy about that request, so that didn't happen. So I ended up quitting in '96. I was not working outside of the home for 8 years. The overall healthcare system, I'm not real pleased with it because there's really nothing for adults and children, unless they are in need of certain services, they're ineligible. Adults, the adult basic, there's such a long waiting list that it could take you forever to get to the top of that list to receive anything, and my understanding of what to qualify for Medicaid or access, that OMAP wants you to be working so many hours a week, but then once a person works those hours a week, then they're over income for eligibility. So to me it's like a catch-22 situation, and there's just nothing out there.